Hello, I'm Tim Vine, Vice President Corporate Support Services and Chief Financial Officer of the Manitoulin Health Centre.
And I'm Paula Fields, Vice President of Clinical Services and Chief Nursing Officer at Manitoulin Health Centre. So the idea of the field hospital, more formally known as Alternative Care Centre, came forward from Dr. Mike Bedard and Bill Cranston in response to the pandemic. The Manitoulin Health Centre, at the time, part of our surge capacity planning was to open up additional beds at the Little Current site. Once we had our first COVID case admitted, the Little Current site would be COVID positive patients, where the Minnemoy site would be COVID negative patients. However, what was happening across the country, we quickly realized that we would require additional beds. So we went into action with our teams and with the cooperation of the townships and municipalities and First Nations across Manitoulin. We built the Alternative Care Centre, or Field Hospital. The Field Hospital is a 27-bed site where we will care for patients who are transitioning from their acute stage into their recovery stage of COVID. So they would be cared for acutely at Manitoulin Health Centre, and when they're well enough to transition to the field hospital, they would be moved to the field hospital. And there's also consideration for caring for palliative patients at the field hospital. So each of the units clinically has a bed, a hospital bed, electric bed, so we can position it accordingly to the patient's condition. Also we have wheelchairs, commodes, walkers, as well as recliner chairs, so patients can mobilize. That's very important that they're able to get up and sit. So lying supine in a bed the entire time is not best for patients' recovery.
We've tried to construct things as simply as possible, but also with an eye to it being reused if it doesn't have to be used for a pandemic. The surround is fully wipeable, non-porous surface, so we can provide good infection control. But it's really, as you can see, comfortable but back to basics here to provide the supportive care that might be required by our patients.
So as far as the type of care provided here, of course, we didn't have the capacity to buy all of the equipment that we would have in the hospital. We have developed all the policies and procedures for nursing. Back to basics, as Tim said, we would go back to counting drips with our IV. There'd be no IV pumps. Back to paper-based charting and caring for the patient. We have plans to put in a call system as well as a monitoring system. We have a medication room set and ready to go, as well as where we would locate the nursing station so we can view the patients easily. Human resourcing plan, we have a number of options ready to go if needed. That includes physicians, nurse practitioners, RNs, RPNs, as well as PSWs, depending on the need. And of course, if it comes to the point where we need to open the field hospital, we also have to look at human resources and what is actually available. We've had a number of our retired nurses and community members come forward offering to help if needed. Should we do a walkthrough?
So this is just one of 4 rows of beds that we have in the facility. And as Paula mentioned earlier, there are 27 beds. On what folks will be accustomed to as the stage, this is where our nursing station will be, elevated to provide better sight over the entire facility. Right at this point, we're within 48 hours of readiness to admit a patient, so not everything is done, but we're at the stage where with one final blitz, we would be able to admit a patient within 48 hours. So we've got desks and computers to set up here for the nursing station. So you probably would have seen the story that was covered by the expositor with the development of this mask in conjunction with a Southern Ontario scuba dive company and some folks here on the island. This is the Cobra mask that provides protection, personal protection as a substitute for wearing a mask and a face shield. The virtue of it is that it can be used all day long without having to replace those disposable pieces of PPE, so we can preserve that disposable supply. It comes with 2 filters that are essentially an N95 filter that will go on filter in and filter out of this piece of equipment. Can also be used, I'll hand that part back to my clinical colleague, but can be used for support for patients as well.
Yes, it can. It has been found across the country. They've been able to provide oxygenation through the mask for patients. I also want to mention that if it comes to the point that we are required to open the field hospital and alternative care center because we're over capacity at the Little Current and Mindemoya sites, there's definitely likely going to be a shortage of PPE, so the regular masks, face shields. So this is a great alternative. We have enough to staff the field hospital, and we're able to disinfect in between use as well.
So, considering the lightness of everything, it does have a fair bit of privacy for each of the patients who might have to be in here.
Yes, and that was important with the development of the field hospitals. We have to, even though we'll be in an acute state of the pandemic, we have to still consider patient and family privacy. So the Nimi Rec Center was really the ideal place to set up a field hospital or alternative care site, especially when you're dealing with infectious diseases, as we are actually able to separate and have a COVID positive infected area, as well as a non-infected safe area for staff to rest in and for administrative duties to happen. And so the break between the infectious area and the clean area is this transition area, and I'll let Tim explain the rooms.
Thank you. We've got 3 chambers here to move from COVID positive to COVID negative. Again, constructed very similarly to the surrounds for the patient care rooms. Fully wipeable, non-porous material on the wall. These were temporarily put in order to facilitate this. So this would be the first doffing or removal station where any of those pieces of clothing and equipment would start to come off that have been in the infected area and left in a hamper here for transportation to MHC to be laundered. In the next chamber, this is where all of the remaining equipment and clothing comes off, including that Cobra mask that you saw earlier, which would be fully submerged into a solution to disinfect it. In this room as well, we would provide the ability for a hydrogen peroxide solution for staff to be able to wipe themselves down, and basically right down to the birthday suit in this room. Then moving through into the final chamber, this is where clean scrubs would be provided, and the staff could don clean attire to be able to move into the non-COVID area, so that we keep a lid on the infection and where patients who are COVID positive will continue to be treated.
Did you want to talk a bit about the food services and the ability to provide that service through this center?
Sure. So we obviously will have to feed folks, and we've made plans around the full commercial kitchen that's here in the curling club to use that in order to produce food to be able to feed our patients who are here. We've made staffing plans, as Paula has for the health human resources side, for the support services side, to provide not only for food service but also for cleaning and infection control. We've worked very closely with our infection control nurse at MHC to come up with these plans to ensure that everybody is kept safe as they move through this environment.
I think it's also worth mentioning, so we fielded questions about, so we're going into wave 2, what if it doesn't come to the point the wave 2 doesn't hit us like as expected and come to the point that we need the field hospital. So MHC feels that this is a great opportunity for any type for emergency planning for the whole entire Manitoulin community. We're able to dismantle everything in the field hospital and to put it into storage, and we'll be prepared to respond to evacuations required at either site of Manitoulin Health Center or a long-term care facility. If there was some type of natural disaster where we had to increase capacity, then all of this equipment and policies, procedures will be ready to go at any time. So we're also planning for the future.
So we're in now firmly in the non-COVID part of the Alternative Care Center. You'll probably recognize our surroundings as being the curling club. And in here we'll be able to provide a staff lounge as well as administrative support area. So we've put in IT infrastructure throughout the Channel View room, which is the main ward, and in the curling club so that we can support access to electronic health records, even though we will have a paper-based system here. We can also do food service in this area for our staff as we envision supporting them with food through their time here.
And as I mentioned previously, really this facility is ideal in regards to infection control practices and separating the infected area from the non-infected area, and that we're able to have staff enter through one of the curling club entrances over to the arena side when they're coming on shift, as well as we are able to receive our supplies and have administrative staff come and go and not enter through the infected area.
Of course, this wouldn't be possible if it weren't for the Town Council of Northeastern Manitoulin and the Islands, and we want to express our deep thanks to them for making this facility available for use by the community. And of course, we want to thank Chief Linda Dubosky for her leadership in the ventilator campaign that has provided another layer of protection for our patients and for the broader community. So thank you very much. Chimigwich.
And we'd also like to recognize all of the community members who supported the Manitoulin healthcare providers' efforts through donations, through letters of support, and many other means that we saw your support throughout the first wave of the pandemic. And Tim and I would also like to thank our teams at MHC, both the corporate and clinical teams. It has been very trying times, but everyone really came together and worked hard to move us forward to fight the pandemic. So thank you very much.
From the bottom of our hearts, thank you.